So this is a good time that we need to move on to the question and answers. I have received a number of questions, but looking at the time limit, I am going to pose a couple of questions that I would ask my speakers to reflect upon. Let's start with the first question. What solutions digital health and data can provide to prevent any future epidemic? Kyu, it's over to you.
Yeah, so the opportunity as it relates to prediction is really essential, as I was referencing the determinants, data, and decision paradigm. So when we're talking about predicting a next pandemic, as my colleague was speaking about, like something like air travel, that type of determinant and data could be very useful to help predict. So the piece I want to emphasize here is the issue of trust across an ecosystem. So health is very local. You need data and determinants from multiple typical entities, stakeholders, hospitals, health systems, payers, governments, life science companies. So bringing that data set together, it's often not about the data. I would suggest we don't want perfect data to be the enemy of good and predictions, but ultimately it's about bringing that data together, applying traditional analytics, potentially machine learning and AI analytics to better predict, to better personalize, and to prevent those epidemics or pandemics.
Thank you, Kyu. That's helpful. Any further reflection? I think the work you and your institute did, there might be some things we can learn that how best we can prevent the future epidemic. Of course, it is not prevention, but mitigating and managing as well.
Yeah. Well, of course, from every pandemic, every epidemic, we learn something, and the response to the next one is always more rapid and more efficient. But I think that the most important challenge is to quickly acquire the knowledge needed to tackle the infection. So if we don't know what we are talking about, it's impossible to adopt appropriate measures. I think in this case, the scientific community have a huge responsibility, and then the public health one to let's say synthesize the scientific information that quickly and in maybe a coordinated way emerge in the beginning, and to provide recommendation. So central is quickly understand the disease infection natural history, the transmission modes. So this is becoming in the pandemic. I studied in my career. I see how this became increasingly fast and rapid. So that's a good thing.
Thank you. Both of you mentioned the need for more data. It is easy to say, difficult to do. So what's your experience in collecting, analyzing, and developing certain products or outcomes based on the data? And Kyu, I know that I think IBM Watson and you have got a very good platform. So any examples, or very briefly, you can say that what sort of data you were trying to collect in terms of this pandemic, and plus what challenges you faced? And then same question I will ask to Chiara.
Yeah, I would go back to what I referenced. Data is essential to benchside, curbside, bedside, those types of opportunities to get insights, to get the right information to the right person at the right part of the workflow to make the right intervention. So we've learned that there's a lot of publicly available data out there. Data on, for example, non-pharmaceutical interventions in the age of COVID. That's publicly out there, but it's typically situated on multiple websites and multiple government sites. And so collecting that, as we've created a dashboard for non-pharmaceutical interventions across the globe, typically requires a level of human intervention to validate the websites as being trusted sources of information. But then you can use AI and other technologies to scrape the data on a regular basis and get it accurate. And then the key is to bring it to different stakeholders. So I would suggest, there are many people who say we don't have enough data. I would suggest we have enough data to at least do much better. But then a lot of the challenges about these issues of trust and transparency and data principles, and many parts of the globe have different cultures as it relates to data and whether or not I will share my data with, a government entity or a private sector entity. And so these principles need to be globally understood and embraced, recognized, transparent to the global citizenry, but also, recognizing the role of the private and the public sector in supporting the infrastructure to support those insights that come out of the data.
Thank you. Chiara, any reflection?
Well, okay. From my point of view, I think that the big challenge I mentioned during my presentation is to capture human behavior, because human behavior determine how an epidemic spread. It's a fundamental component in how an epidemic spread. But it's important to notice, I would like to stress that an epidemic is a collective behavior, so a collective phenomenon. So we don't want information of a specific person, of you or me or what else. We want, let's say, the behavior of the population. So this is why the data, normally an epidemiologist, an epidemic modeler need are data on mobility fluxes of you aggregated data aggregated spatially. For instance, an important let's say, something important happened during this pandemic is that a lot of people got access to mobility proxy from mobile phone data. These data are absolutely anonymized and aggregated and simply tell us how people are moving around. This information is fundamental, for instance, was fundamental to understand the impact of lockdowns implemented in many countries. And this is an important resource. And yeah, we witnessed an advance and improvement of these during this pandemic.
That was a very good added value, what Kyu said before. There is another question, maybe the last question. I think we have put a lot of emphasis on digital health. The question is digital health and tools are enough in this fight against pandemic? Or we need to supplement it with some other approaches? I know this is a challenging question because while the topic is on digital health, and we cannot make digital health panacea for everything, but I would like to have your views again, that do we need anything more than digital health in order to deal with pandemic? So Kyu?
So we've been reflecting on this at IBM quite a bit and with our clients and our partners. And so I'm going to use the acronym of COVID to talk about the areas that we think are essential in this new era. So C is collaboration. As I mentioned, the collaboration across an ecosystem, across academia, across media, across hospitals, health systems, governments, life science companies, citizenry, you can't underemphasize the issue of collaboration and trust. I think COVID has also made us realize that health is not just my health. Candidly, when I wear a mask or, with the asymptomatic, the pre-symptomatic, the post-symptomatic spread, the O is our health. We need to recognize this is all about our health, whether it's me, my family, my community. And so, 100 years ago, infectious disease was the #1 killer. And then non-communicable and chronic diseases became the big focus for us as a society to get those extra years of life expectancy. And now infectious disease is back upon us in more ways than ever, at least in the developed world. In the developing world, infection still is incredibly prevalent. So the V is values, as I mentioned. Do we value equity? Do we value resiliency? Do we value community, science, and also resiliency and prevention? True prevention is where you prevent the disease. I is innovation. I would suggest digital health represents the cultures of healthcare and public health and tech. In technology, we're very used to iterating and changing very quickly. Health takes 17 years from discovery to delivery, as we discover. That's a long time. We don't have time for a global pandemic to wait 17 years for discovery to delivery. And then the last one is D, data, digital infrastructure. So that would be my recommendation.
Thank you, Kyu. Chiara, anything you would like to add to this?
Well, I think that digital art is, of course, revolutionizing our way to tackle pandemic. It's improving our capacities. But my view is more a view centered on people and the expertise of people, in particular, people working on public health. So we need experience, we need the capacity of interpret the data. So I stress that data provide always, by definition, a partial information. Even there are no perfect data. Even if data are without errors, still they provide a partial information. So we need the experience of interpret them, and also another human component. Let's say that for me it's important is the human component needed for gaining trust of people. I'm talking about, for instance, one example very debated is the one of digital contact tracing. This is a good example. This is something that is really promising, and I really, let's say, I'm really interested into this, but I think that the best of this is when this is combined with manual contact tracing, with the intervention of expert people that can follow people's the patients and provide assistance. This is an important aspect.
Thank you, Chiara. Thank you, Kyu. I'm sure what you presented, what we discussed through questions, it is going to add a lot in the knowledge we are generating through this summit. And the knowledge is what we need as humanity and need to take actions. So I will thank both of you. And now next I will summarize and reflect what we discussed and what should be the way forward. So when we started this session, I talked about the definition of public health. So we are clear that the digital public health is the way forward. And we need to be mindful that through this summit, we need to ensure that we should not be in future using the word digital public health, rather digital should be part of public health, and our definition of public health should encompass it. What other thing I can reflect on, that what pandemic has done to us as a society, or in particular to the public health in all over the globe and in every country, on mainly on three aspects. First one is that we came to know about the importance of data. And I say data, not like because I lead on deal with it, or in Scotland we are managing it pretty well along with a number of other countries. But the question is, this is the first time from the front line to the policymakers, they start realizing the importance of data. But I would like to say that it is not the data, because we do have enough data. I say that we are data rich and intelligence poor. So we should be able to change that data into applied intelligence. And those, the good speakers, they already mentioned how they were able to change some of those data into applied intelligence. So we should be mindful that the first thing we have learned, we need to have more applied intelligence. Second thing, we start realizing health is connected with wealth. Because what has happened in pandemic and COVID, and which is happening with the non-communicable diseases, when our health is bad or the health outcomes of any country is bad, then it means that their GDP is low. So we need to collect more applied intelligence, or generate more applied intelligence in terms of broader determinants of health. Because these broader determinants of health are going to help us to improve quality and decrease costs. And the third thing which I've learned, which is very important, is that we are not in a position to ask people that they should be thinking that we can provide them the services. We should be thinking how we can co-create health. In order to co-create health, there are a number of examples quoted in many sessions yesterday. which is happening in Kingdom of Saudi Arabia, providing them tailor-made information on their mobile phones so that they can co-create health. So these are the three lessons that are very important for our public health and for our digital public health. Then I also say the time has come that we need to move from stethoscope to datascope. It means if our clinical interventions were very important in the past, and we were using those clinical interventions to improve the public health outcomes, now we are generating a lot of data. And we are able to analyze it, and we are able to change them through the machine learning and other tools into applied intelligence. So it means that we need to start looking into the data scope. We need to let our workforce, everyone who is listening today, they need to start thinking, have they got the digital health or data literacy? It means, are they able to access, understand, and use the data and digital tools? So I would conclude by saying that this was an excellent summit. It has given us a good platform. Thanks to Kingdom of Saudi Arabia, G20, and the organizing committee. And I'm sure we will hear more from the people. But the take-home message is, if you want to make a difference, then you have to include digital public health in your strategies. Thank you.